Hi, it's Hannah here from Physic Health Consulting. I had a lady patient come to see me the other day and she commented that she's really pleased that I'm looking out for her, which I thought was really lovely, but she's not the only patient to say that, and I'll explain why. So this lady's been working with me for a few months now. She's responded really well to her herbal treatment, but over the past few weeks some new symptoms have cropped up which really need to be looked into fairly quickly. By the time she saw me the other night, she was already on the case with this, and she booked an appointment with her GP the following day. So I said the GP is most likely to send her for some further tests, and indeed they did, which is good. That's what we expected. But I said to her, if for any reason they don't, to let me know, and then I can write them a formal letter explaining the situation and seeing whether we can facilitate that process a little bit more quickly. So she said, oh, it's really nice that you're looking out for me, and that's my job. That's a large part of my role these days. My role has developed over the last 20 years since I've qualified, as the NHS is struggling more and more and doctors are under more time pressures. Sometimes they just don't have the time to explain the treatment to the patient, and the patient can go home with worries or concerns or a little bit confused about what's going on. Sometimes patients are under several different doctors at the same time, and although they all communicate with each other, it can feel like a bit of a fragmented approach, and they don't fully understand the big picture. And sometimes patients come and see me, and because I have an hour-long consultation to begin with, and I hear about everything at the same time, which is not what a doctor does, I can join the dots very quickly. And sometimes I think, maybe something's been missed, or maybe that's a misdiagnosis, and then I can go ahead and write to the doctor accordingly. So once I've written that letter, that's then on their medical record, and usually the doctor will follow up and say, okay, let's try a new treatment path, or let's get some new tests underway. And that I see as a really important part of my job. Sometimes it can even be life-saving, and it's so worth the investment. People don't realise that this is what medical herbalists do, but we do it all day, every day. I'm guessing this may possibly resonate with you. If it does, could you make an appointment to have a chat with me, and we can just have a chat, see what the situation is for you and what the best course of action would be going forward. Feel free to message me or give me a ring. It's 077 63 595 879, or you can go to my website at www.physichealth.uk and book online there too. Okay, bye.